Every year, millions of men take Tadalafil, some for erectile dysfunction, others for prostate problems, and even for heart or lung conditions. It's often called the 36-hour pill. But here's the shocking truth. While Tadalafil can transform lives, it also carries hidden risks that most people never talk about. In this video, we'll reveal the real side effects of Tadalafil, from the mild headaches most men experience to the dangerous complications that can put your life at risk. And make sure you stay until Chapter 7, because we'll uncover the single most dangerous mistake men make when taking Tadalafil, one that could be fatal if ignored. Let's dive in. Like every medication, Tadalafil comes with side effects. The good news is that for most men, they are usually mild and temporary. The most common include headaches, reported by up to 30% of users, facial flushing, that sudden warm red sensation, nasal congestion, a stuffy nose shortly after taking the pill, indigestion or stomach discomfort, sometimes described as heartburn, back pain, and muscle aches, particularly noticeable the next day. These side effects happen because Tadalafil doesn't just relax blood vessels in the penis, it relaxes blood vessels all over the body. That wider action is why some men feel discomfort in places they never expected. For most, these symptoms fade as the drug leaves the system. But here's the question: when do side effects stop being normal and start being a warning sign? In the next chapter, we'll talk about the moderate side effects, the ones you should never ignore if they persist. Not every reaction to Tadalafil is harmless. Some side effects signal that your body is struggling with the drug and you need medical attention. These include prolonged back pain or muscle aches that don't improve after 48 hours, dizziness or lightheadedness, which may suggest a sudden drop in blood pressure, persistent indigestion or abdominal pain, especially if combined with nausea, vision disturbances like blurred vision, sensitivity to light, or a bluish tint in sight, hearing changes, including ringing in the ears or sudden hearing loss. These effects are not as common, but when they appear, they're red flags. They indicate that Tadalafil is affecting more than just your blood vessels. And yet, there are even more serious risks, rare but potentially life-threatening. In the next chapter, we'll uncover the severe side effects that every man must know before taking Tadalafil. While most men tolerate Tadalafil well, there are rare but serious risks that can't be ignored. Priapism, an erection lasting more than 4 hours. It may sound like a joke, but it's actually a medical emergency. If untreated, it can cause permanent damage to penile tissue. Severe drop in blood pressure, especially dangerous if taken with nitrates or recreational drugs. This can cause fainting, shock, or even cardiac arrest. Sudden vision loss, a rare condition called NIAN, non-arteritic anterior ischemic optic neuropathy. It happens when blood flow to the optic nerve is blocked. Hearing loss, sudden decrease or complete loss of hearing, sometimes with ringing in the ears or dizziness. Serious allergic reactions, swelling of the lips, tongue, or throat, difficulty breathing, or hives. These side effects are uncommon, but when they occur, they can be devastating. That's why Tadalafil should never be taken casually. It's a potent drug with systemic effects. But what makes these risks even more dangerous are the drug interactions. In the next chapter, we'll look at the medications and substances that can turn Tadalafil from safe to deadly. One of the biggest risks with Tadalafil isn't the pill itself, it's what you combine it with. Nitrates, used for chest pain or heart disease. Mixing nitrates with Tadalafil can cause a dangerous collapse in blood pressure. This combination is absolutely forbidden. Recreational drugs, substances like ecstasy, cocaine, or even marijuana can intensify Tadalafil's effects on blood vessels, leading to unpredictable and sometimes fatal reactions. Alcohol, while not strictly forbidden, heavy drinking with Tadalafil increases the risk of dizziness, fainting, or dangerously low blood pressure. Certain antibiotics and antifungals, drugs like erythromycin, ketoconazole, or itraconazole, slow down the liver's ability to break down Tadalafil, making the drug accumulate to unsafe levels. Blood pressure medications, some antihypertensives can interact with Tadalafil, increasing the risk of sudden drops in blood pressure. The bottom line? Tadalafil should never be seen as a party pill. It's a serious medication, and mixing it with the wrong substances can turn a night of pleasure into a medical emergency. But what about long-term use? In the next chapter, we'll uncover the hidden risks of daily Tadalafil and what the research really says about using it for months or even years. Tadalafil is unique among PDE5 inhibitors because it can be prescribed in a low daily dose, usually 2.5 mg or 5 mg. This means men don't have to plan sex. They're always ready. But is it safe to use every day for months or even years? Research shows that for most men, long-term use of Tadalafil is well tolerated. Studies found no significant changes in testosterone levels, sperm quality, or fertility. Many men even reported improved confidence and relationship satisfaction with daily dosing. However, there are hidden risks. Cumulative side effects. Some men develop persistent headaches or muscle pain over time. Kidney and liver stress. Since the drug is metabolized by the liver and excreted through urine, men with organ problems may face complications. Psychological dependence. Some men start believing they can't perform without the pill, even if physically they could. So, is it safe? For many men, yes, but only under medical supervision with regular checkups to ensure the body is handling the medication properly. But not every man can take Tadalafil safely. In the next chapter, we'll talk about the men who should avoid it completely, because for them, the risks outweigh the benefits. Tadalafil may seem safe for most men, but there are groups who should completely avoid it. For them, the risks are simply too high. Men with heart disease taking nitrates, as we saw earlier, this combination can cause life-threatening drops in blood pressure. Men with severe liver or kidney disease, because the body cannot metabolize or eliminate the drug effectively, leading to dangerous accumulation. Men with uncontrolled high or low blood pressure, Tadalafil alters circulation and can destabilize blood pressure even further. Recent stroke or heart attack patients, their cardiovascular system is too fragile to handle the extra stress. Men with rare eye conditions like retinitis pigmentosa, because Tadalafil may affect enzymes in the retina, increasing the risk of vision loss. Doctors emphasize that Tadalafil isn't a lifestyle supplement. It's a prescription drug that demands caution. For these men, alternative treatments may be safer. But even for healthy men, the greatest danger comes from misuse. In the next chapter, we'll uncover the most dangerous mistake men make with Tadalafil, a mistake that can be fatal. What is the single biggest danger with Tadalafil? It's not the pill itself, it's how men misuse it. Many take Tadalafil without a prescription, buying it online or even on the streets. The problem? These pills are often counterfeit, containing the wrong dose or even harmful chemicals. Men frequently mix Tadalafil with alcohol or recreational drugs, dramatically increasing the risk of collapse, heart problems, or stroke. Some take multiple pills at once, thinking more means stronger performance. In reality, it just increases the chance of severe side effects or priapism, a painful erection that can cause permanent damage. Others use it as a party enhancer, ignoring the fact that Tadalafil is a powerful vascular drug, not a recreational stimulant. This misuse turns a safe, effective medication into a dangerous gamble. It's like playing Russian roulette with your health. So, is Tadalafil worth the risk at all? In the final chapter, we'll weigh the real benefits against the dangers, helping you see the full picture before making a decision. So, after everything we've uncovered, the mild side effects, the moderate warnings, the rare but severe risks, and the dangers of misuse, is Tadalafil really worth taking? The answer is, for many men, yes. When prescribed by a doctor, monitored carefully, and used correctly, Tadalafil can restore confidence, intimacy, and quality of life. Its unique duration and flexibility often make it the preferred choice over other ED drugs. But here's the other side. Tadalafil is not a magic pill. It's not for everyone. Men with heart disease, uncontrolled blood pressure, or certain medical conditions face real risks, and anyone who misuses it is putting their health, and sometimes their life, on the line. In the end, Tadalafil is a tool. In the right hands, it can be life-changing. In the wrong hands, it can be dangerous. And in our next video, we'll explore a side of Tadalafil most people have never heard of, how it's used to treat conditions far beyond erectile dysfunction, including prostate problems and even heart and lung health. So don't miss it. And remember to like, share, and subscribe to stay informed about the truth behind men's health.